want to welcome you to one of our community meetings we have. Maybe every couple of months or so, we have these types of meetings, and we bring in experts on certain areas. And the young ladies here will be talking, and Allan will introduce them going down the road. So I'm just going to start with, I'm going to ask Mark to lead us in the pledge. Would you, Mark? Thank you. Better. I'd like to thank you to still do my statements. And to the which it stands, one nation, under use this law with liberty and justice for all. Thank you. Thank you, Mark. Appreciate that. I don't have much to say now. I'm going to wait till the very end so you get through the people that had something of real importance to say. Once that's all finished, then I'll wrap it up by telling you a lot about what's happening in Estero, the kinds of things we're involved in, and so on. I think you'll be impressed. So I'm going to hand it over to Allan, our Chief Communications Officer. Many of you know him, and now I'll take it from here.
Thank you, Jim. Yeah, sure. Well, very good morning to you all, and at least it's nice to see a number of people here, given the conditions that we had yesterday, as Jim mentioned. One of the things that it is important for you to know, and also the speakers, I think I mentioned this to them, that some of you may not be aware. We have Wilson with us today. He's our videographer and is reviewing what we do today so that we produce this particular video on YouTube. So that when it's finished, after a little editing, my colleague Kim Daly will actually post that with Wilson on YouTube so that people can obviously look at it later. We'll also do a summary, I will, of the issues that have come out from today's meeting. I'm obviously very pleased to have a number of very important experts with us today. I'll introduce them one at a time. We appreciate them giving their time up from their busy schedules to come to us and obviously speak to you. That's very kind of them to do that. And as I said, we really do appreciate it. And I'm actually going to introduce our first speaker, since there is a fair number of things to cover today, so I'm not going to say anything further at any length, other than to say that it's my pleasure to introduce Jonathan Witenko. Jonathan has actually given a talk here at the Engage Estero meetings a little while back. He is the System Director of Virtual Health and Telemedicine at the Health. One of the things that's, of course, happening at a fairly breakneck speed, which you'll talk about in the healthcare area, is the significance of artificial intelligence as it's being applied to healthcare issues. It's a very, very interesting area. I know Jonathan is very involved in this. And it'll be very interesting and delightful to hear what he has to say. So over to you, Jonathan.
I want to talk about today artificial intelligence and how we perceive it, how we're working through it, and the responsible use at Lee Health. So this is something we've set up, goodness, 2 years ago, almost Thanksgiving. ChatGPT came out on the open market. So I've been working as a computer engineer by trade, so I've got a master's degree in computer science, MBA, and so I've been around technology for a long time, been around healthcare for around 20 years. Grew up in Fort Myers, my parents moved us down from New York right before Hurricane Andrew in, 1992? Right when Lee went from one hospital to two and built out health parks. And so I was a volunteer, wandering through the halls, getting into trouble, breaking into the doctor's lounge. And fast forward, went to college, and first job coming back was actually at Lee, or Lee Memorial back in the day. Then went away for about 10 years to do banking, run their IT systems for a regional bank. And the economy crashed, back to the hospital, said, I need to do something I enjoy. I need to do something that brings value. Not that no disrespect to banking, just something I believed in. Had some personal events in health history that said I want to go back to healthcare. So I've been there for the last 15 years now, working on all things kind of emerging technology. So started doing 2014 it was, actually about 2013. I had 5 children. And then so one of those children, it was Father's Day. And my daughter, at the time, she was 5 years old. I had a 6-year-old with newborn twins, so house is pretty chaotic. Well, my daughter comes up to me, she wants to do a backflip, and she does a backflip in midstream. She kind of pushes off, ends up landing on the floor, cracking her skull, and just lets out a bloody scream, starts bleeding. Oh, man. So I called my friend who's an emergency room physician, and I'm like, Jill, what do I do? And she goes, okay, it's higher than 3 feet. Is there cerebral spinal fluid leaking out? I'm like, Jill, I don't even know what you're saying. Ooh, she goes, take her to Health Park. This is before Golisano was built. So I run her over to Health Park, and the doctor was like, listen, I'm sorry, bad news. We don't have a pediatric neurosurgeon on site, so we're going to have to fly it over to Miami. So I called my wife, and she's like, well, I'm not bringing the twins on a helicopter. Like, what are we going to do? And I said, you stay home. Let me get to Miami, and we'll figure this out. So we'll talk to my parents, and my parents are up in Orlando. They're like, should we drive to Fort Myers? Should we drive to Miami? And I said, I don't know, just get on the interstate, start driving, and I'll tell you kind of in a couple hours once we land. My wife's parents, both local, were in 2 different hospitals, one for a hip replacement, one for the heart issue. So they were out of commission. So again, logistically, it was a mess. Now, let me rewind a little bit. I work as an engineer, working on security, working on all kind of technical systems. I sit in a cubicle, don't really interact with the real world, with patients. I just do my thing, turn it in, submit it, okay, and move on. So a lot of the projects I do, I don't get to see in fruition. Well, about 6 months earlier, they said, hey, we want to start a partnership with Miami Children's Hospital. We want to do some, collaboration and networking and all this kind of stuff. Can you build out the technology that'll connect us to Miami Children's Hospital, because they have some doctors that are specialists that can help us. Sure, great. Worked through the whole project, and we finished. I trained some of the physicians how to use the technology. You're going to go in, this is how you're going to connect, these are the systems, make sure it's secure and safe. You can see the patient's information, you can see their brain scans, all this kind of stuff. So I finished on Thursday. Well, fast forward, now 2 days later, sitting in the hospital, and the doctor comes back in the room after about 5 minutes. He said, I have great news. I'm just reading a flyer. I didn't really use email a lot back then. This 10 years ago, 12 years ago. I just got a flyer that says we now partner with Miami Children's Hospital. The doctor is going to actually look at your daughter's scans. Well, the doctor, they get on the phone, they talk through it. They hand the phone to me, and I talk to the doctor I just trained. And he's like, John? And I'm like, yes, doc. And he said, no, looking at the scans, we can actually treat her at Goals or at Health Park. You don't have to transfer her, and so we can give her care right there. And I'll just remotely monitor it. So fast forward, because I always forget, my daughter's totally fine. She's 15 now, and to my chagrin, she's a cheerleader, and she gets thrown up in the air and loves to fly. And she's not traumatized by this at all, even though I am. And so I got to work on the program. I was, unfortunately, the first patient, or my daughter was the first patient to actually utilize the system. So for me, from a faith perspective, like, what a God moment. That's something I can do. I'm not a physician. I don't get to interact with patients. What scares me, kind of quizzes me out. But I can do the next best thing, and that's helping those that can. Helping the providers, helping the nurses, helping the caregivers give that care. Helping the patients receive that care. And so that, for me, was a career-defining moment of, how do I do more of this? So my daughter stayed 4 days ICU, triple skull fracture, ruptured middle eardrum, but totally fine after the fact. Basically just, don't play football for the next, couple months, while her, skull, heals. But fast forward, I go back to work, and I'm like, how do we do more of this? And they said, there is no more. This was kind of a one and done. I said, no, this is the future of collaboration in medicine. How do we start to participate in this? And so I went over to Miami Children's Hospital, met all the senior leaders there, the CEO, and said, we want to partner more and more. And that's where telemedicine was born. So we started doing that 2014. Worked with our a neurologist at the time and said, how do we do telehealth to connect, basically so I don't have to drive down these roads and go from one hospital, from Coconut Point to Health Park or to Cape Coral, while a patient is having a stroke. 65,000 brain cells die every second, in a stroke. And the difference between, that 45-minute drive from Health Park to Cape Coral, especially, all snowbirds are coming back, and the roads are going to get pretty busy soon, there's no value to that time while the physician is driving through, down 41. So how do we connect? And so we built a system in about 3 months that would connect the physician, whether they're at HealthPort or they're at home or they're across the country, to connect and remotely interact with the patient, give them the appropriate diagnosis, and then give them, it's called TPA, which is this special drug that only a neurologist can give. Now, the corollary is that why don't we just have a neurologist sitting waiting at every hospital 24 hours a day? Medical economics, I went to school for this, and the challenges, a neurologist makes around $300,000, $400,000, $500,000 a year. We would have to put we have 5 different hospitals. We'd have to put one in every hospital in order to staff a 24/7 model. You get 4.3 FTEs. So we'd have to spend about $2 million per hospital. It's corollary. We put this technology in, cost us about $150,000 one time, and then we pay a third-party company that has neurologists all over the country. I think they have 160 neurologists that within 3 minutes, there'll be a neurologist on the screen making your diagnosis and giving you the appropriate medicine or care plan. So we've taken it's called door-to-needle time. Again, I don't want to get geeky on the medical side of it, but that magic window of when you can get the special drug, it's the difference between getting the drug and walking out the next day or spending a couple months in rehab and leaving in a couple weeks in a wheelchair. So the goal from the system, the goal from the community, it is how can I receive the proper care as quickly as possible, as cost effectively as possible. So that's what I've been doing. I've been working with our chief medical information officer. He's a neurologist. The two of us built the system together. I built the carts in my garage, which is kind of scary. We just removed them, I think about a year ago. We finally bought new ones, and they've been running for 10 years now. And so that's what I get to do. I get to do fun stuff. I get to really push Lee on the boundaries of where can we go tomorrow. My boss, again, CMIO, was at a conference this week on AI, looking at, okay, where are we in lens of the rest of the country and the world? And are we on the forefront? Are we lagging behind? And he's been texting me nonstop of, hey, we're actually doing good on these things. Well, you need to think about this. So it's really reaffirming that here, little Southwest Florida, we're actually on the precipice on a lot of stuff. We've been putting out technology and workflows that are on the cutting edge from the entire nation. And I'll start to talk about some of those today. So I'm going to go way back kind of ground level on what is AI. That's kind of the goal today. What is AI? What are we doing at Lee Health? And then I want to talk about probably the scary thing, the risks of it. Because I'd be ignorant if I just stood up here and said, it's amazing, there's no problems whatsoever. So I'm going to go through those and how we're pragmatically thinking about, it's great that we have this technology. It's not a question of can we, it's a question of should we. So this gets a little small on here. So what is AI? And I'm not going to expect everybody to come out here with a PhD in machine learning. That's not the goal. The goal is to try to introduce you to the concept. So really at the bottom line, AI is just statistical probability. It's the computer or the machine learning, the algorithm, trying to figure out what is next. What is the next logical conclusion or decision that I should make? It's the same thing we do when I walk into my closet in the morning and go, okay, what should I wear? Well, I just wore that shirt yesterday. I'm not going to wear that. These are, this is dirty. So I'm jumping to the next logical conclusion. There's no right answer. There's a million right answers. I could have worn a blue shirt, a pink shirt, a yellow shirt, but I'm making the next logical conclusion saying, all right, I'm a big Gator fan, so I'm going to wear orange and blue today, even though it's a bye week. Thankfully, we're not going to lose. And so trying to think through, and the computer does the same exact thing. It's trying to think. Again, I say think loosely. It's trying to anticipate what is the next logical jump. So you see this in your real life. If you've ever used Google, it says you start typing. And this they released several years ago. It's not in the last 2 years with generative AI. They've had this feature for many, many years. But you start typing, and what is it doing? It doesn't know me any better than, well, probably because me better than myself, but it starts to anticipate it. What is John typing here? So I typed in the letters ARTIM. So I'm typing artificial intelligence. The first thing that popped up was artificial intelligence image creator. Why? Because I'd actually searched for that the night before making a presentation. So it said, hey, this is probably what you're looking for. Now, if Mary had typed that in, probably would have said artificial sweetener or something because she was baking a cake or whatever it was. So it's customizing. Again, it's trying to anticipate the next logical conclusion based on my patterns. But then it looks and says, hey, artificial grass. Now, I've never searched for artificial grass, but I'm sure many people across the country are. So Google's using their own search engine to say, what are other people across the country searching for? So again, it's trying to serve up my next logical best need. Now, you think about TV, of how we watch TV prior to kind of Netflix and the cable revolution. I watch TV and I sit and watch a commercial and I'm watching Price is Right going, none of these ads apply to me. Talking about stuff that I don't subscribe to, I don't care, I'm never going to purchase. But as an advertiser, you're going, okay, generally my audience at 11 o'clock in the morning on a Tuesday is this demographic, and so I want to just cross advertise to them. Well, when I start watching, let's say, Hulu for YouTube TV, the ads are tailored to me. Why? Because they know what I bought on Amazon, assuming they'll probably know when my anniversary is, and they'll say, oh, John, we cross-referenced your Amazon search history. You've never bought anything for your wife, and your anniversary is only a week away, and it's your 20-year anniversary. And it starts to tailor those recommendations for me. Some people say, extremely scary. My wife hates it. Me, I'm like, wow, that's really effective and helpful. I don't want an ad for, women's undergarments. I really want the ad for, a rate or something that's appropriate to me. So now advertisers, again, are starting to market towards that next closest person to help them. It's all based on artificial intelligence. It's called machine learning. So this is a really nerdy slide, and I apologize in advance. How we look at AI, it is this kind of big generic term. So artificial intelligence kind of covers everything. And then you're like, well, listen, I don't work anymore, I'm retired, I don't use AI. Hate to break it to you, you're already using it. So if you've ever, if you've got a smartphone and you try to open the smartphone, and depending on what model you have, it's using your facial ID. Well, how does it do that? It's looking at an image of you, and it has a baseline. And if you remember, COVID, and suddenly I'm wearing a mask, and all the physicians in the hospital, I can't get into my phone. Well, then they change the algorithm to say, okay, this is what you look like with a mask on. Or sometimes I wear glasses just because I can't see, or I'm wearing sunglasses outside. And the algorithm anticipates and says, okay, we know what John's baseline face looks like. Now we know if he puts on glasses. What if I put on those, not Charlie Chaplin, what were the glasses that with the mustache? The marks, yes, thank you. Dated reference. What if I put those on? Can the artificial intelligence understand that it's still me at the core? If you've ever used Alexa or Siri, my home, my kids love to play this game and try it. My kids walk up and say, Alexa, who am I? 10. So I have 5 children, there's 7 people in my house, and Alexa, my son gets a little upset because he hasn't hit puberty yet, so it thinks he's the older daughter. But it's able to articulate. When I ask it a question, it says, oh, the response is, John, the time is this. Whereas my daughter responds, Winslet, the time is this. And that's based on my voice pattern. There's nothing magical that I've done. It just learned my patterns of speech over time and says, we can anticipate who you are, and we can tailor that response to you. So big kind of bubble is artificial intelligence. You've seen this, if you've ever played a video game. This little, character, if you're playing Mario Brothers, the little, mushrooms or, things that come across. They're programmed by a computer programmer such as myself that said, okay, move along until you hit a ball, or your goal is to try to hit this guy and hurt him. That's artificial intelligence at its core. To set up instructions saying, do this until then. Computer programming, it's called if-then statements. So then you look at something, in like natural language processing. Again, this is the Siri kind of stuff. In the hospital, we use something called Dragon. I've been using this for years. Basically, you walk in, or most of the physicians do it outside, so you may not see this. But after you finish your visit, the doctor sits down, picks up a microphone such as this, and talks into it and says, okay, the patient did this, the patient, was last seen on, Thursday, and, had hypertension, history, complained about this, blah, blah, blah. And it records all that. So it interprets my voice, how my speech patterns, and transcribes the entire encounter for me. Really cool. We've been using this for 10 years. The challenge we had was locally, what happens if the physician wasn't a native English speaker? So for years, it was really challenging. And technology had to adapt to understand different dialects, different drugs that came along. So a drug that existed 10 years ago, there's many different drugs on the market in different conditions, different symptoms. So the technology had to advance to understand all those things. And that's called natural language processing. Now, the holy grail that doesn't really exist yet is deep learning. And deep learning is basically how your brain processes. So as I'm sitting out there, okay, it's easy to make the decision of what outfit should I wear. There's no major impact if I had worn a yellow shirt today. But what if I'm driving down the road and, there's a tree branch because, it was a mess getting down here? Well, that's a major decision. So it's really fascinating, and I'm a Tesla geek, so I apologize. I'm not going to talk later about Allan, but what Tesla has been working on, very different than the industry. So the industry is using a technology called LiDAR. LiDAR is basically a laser. It's almost this. So I'm pointing a laser saying, I know there's something, 15, I'm not a great judge at distance. There's something 15 feet away. So I need to stop the car within 15 feet. Now, the drastic difference is, so as I get closer, it's 6 feet, 4 feet, and then you hear with the car, the beep, 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 like if you're backing up, or I drive a giant van that has a beeper in the back that, it's a 15-passenger van. And so that beeps when you get too close. And all it is a laser pointing, like kind of echolocation like that, saying you're closer, oh, wait, you're too close. Major difference. What Tesla has done is computer vision. So Tesla takes an image and says, that is not just only 15 feet away. That's a billboard, or whatever it is, a sign. Signs generally don't move. And we've seen signs over and over again. And signs never get up and run or roll or whatever. Signs always stay there, statistically speaking. So the sign's not going to move. But what if I pointed that and it was a small child? So the LiDAR, laser is just going to say there's something 15 feet away. What Tesla's doing, Tesla's not the only one, but using computer vision, looks at it and says, that's a small child. Small children move. And then they may move at a certain, about 3 miles per hour. So we have to anticipate that the child could move to the left, to the right, up, down, whatever. And so the computer is going to adjust accordingly. So it's constantly looking at all those images to understand, okay, what do we do? And this is full service driving. So again, autonomous driving is this holy grail of how do we get there? And that's really using all the aspects of artificial intelligence, computer vision, deep learning to say, not only do we recognize that that's a small child, we know, statistically speaking, how small children react and move and what they should do. Now, the small child should stay on the side of the sidewalk, but what if they don't? We know the small child could run in front of the car, so we're going to start to slow down and anticipate worst case scenario. Way too geeky, I apologize. All right. So let me talk about how we're thinking about it at Lee. We kind of have it bucketed, so I work at Lee Health. We have it bucketed into 3 categorical areas. The first one is, how are we looking at AI from a patient perspective? You all, myself, as I'm going to the hospital, how do we expose patients to artificial intelligence, use it appropriately, use it cautiously, educate you all about it, and make sure that we're in alignment, that this is what we're going to use, and you're in agreement that this is the best appropriate use for your care. Also, how do we expose this to the clinicians as our doctors? We could talk long and hard about physician shortages, the nursing burnout, post-COVID, just the challenges that we have a growing population, specifically down here. And how do we staff that? How do we support that? How do we handle, the reimbursement and insurance and all those challenges go in? I'll be honest, like sitting on the backside of Lee Health, it's scary looking at the future knowing we've got massive shortage of physicians. I've said to my 5 kids, hey, you want a guaranteed career? Go to medicine. Because, the population's getting older, that, we're living longer and we need physicians. We're not pumping them out in the numbers we need. Third one is the back office. This isn't the fun, exciting side of it, but, as a knowledge worker, how do I do my job more efficiently? How do I look at stuff, and I'll talk through some of it, but, your bill. So your bill comes out, or you go to the hospital, and I just dealt with this with my daughter. She was trying to get, jaw surgery. And so insurance, basically the doctor said, well, you can get it, but I don't know what your insurance is going to pay. So we're going to have to send you over to a specialist. We're going to send over a referral. All right, so they mail the referral, maybe electronic, maybe they can't fax it, whatever. They send it over, and the doctor says, yeah, we'll take it as long as your insurance will pay for it. Otherwise, it's going to cost this. So that whole process, I'm sure you all have been through it, takes days, weeks, months, trying to figure out, okay, can I get this service? How much is it going to cost me? How much out of pocket? All this kind of stuff. The reality is, it's a lot of algorithms just sitting there that some human looks at, takes your paperwork, comes across the desk. Okay, now I'll process this. It's horribly inefficient. So the revenue cycle, automation, the insurance verification, the automation of referrals can all be automated. And we're working on that. Now, it's a little push-pull because insurance is saying, well, hang on. If you go first, if the hospital systems get it first, then we're going to struggle because we're not ready to catch up. So it has to be this nice, happy marriage. And we kind of liken it to, we'll see how dated my references are, war games. Or, when, what was it, the Space Wars, when basically, Russia put out, the first satellite, Sputnik. And suddenly the U.S. is trying to catch up. So everybody's in this arms race trying to catch up with artificial intelligence, saying, oh my goodness, this is real, and it can help save millions of dollars, time, efficiency, all these things. And I'm trying to figure out how to get there, but not get too far ahead of insurance or the payers or whatnot. And everybody's in the same game of, we all want to achieve the same goal. We want to do this together because it can help automate the entire process.
Can I ask a question?
Absolutely, sir.
So the challenge we see is, it seems like Lee Health, NCH, and a few others all have different systems. And getting all the data, together. Now, I had a scan from ProScan, and it didn't automatically come in, but when I went under the desk in Lee Health, they coded in, and then 2 minutes later, the doctor could see it. So the same way the ENT's got his own thing, the neurologist. So is that part of that back end that you're trying to work on at some point in time?
Yes, but a little bit different. Great question. Thank you. So at the moment, actually, NCH converted from a company called Cerner to Epic.
Right.
So Lee and NCH are using the same exact EHR, which is electronic health record. Basically, the big database that keeps all your information. We're using the same. So we were excited at Lee for this. I actually work with Mary Dismarsis a lot to figure out, okay, how are you? Yeah. Yes, we're competitors. It's not real. The challenge is we're all, as you navigate through the system, especially down here, you're sometimes going to, an NCH physician, sometimes going to a Lee Health one, you're having an emergency, you don't care where you go, and you want that information to flow. Because it's highly inefficient to run the same test from doctor to doctor. Because your insurance is going to say, no, we just paid for your EKG last month. Well, yeah, but this doctor can't see it. So we're going to run another $5,000 test just because the doctor can't fax it. Again, that horribly inefficient system is how we've built up our healthcare system over the country, and we're trying to break down those walls. So the key technical term is interoperability, and we're working on this. Everybody is. It's not just the Lee Health thing. It's not proprietary to us. But the fact that now NCH is on the same exact health system, we can see all that information. They can see all of our information. And we've been changing. So Millennium Physician Group, great cardiology practice, great physicians. We work with them all the time, and we exchange a massive amount of data sending to them, saying, we know at the end of the day, you're treating our patients, or we're treating your patients. This isn't a this is a zero-sum game, which basically says there's a finite amount of money in the world for healthcare, and we're outspending every other, developed nation 5-1. This is silly. So when you go back up north, go to Wisconsin, go to Ohio, go to Michigan, I think it's like 75% of the healthcare systems in the US are using Epic, which is the system us, now NCH, a lot of health systems are using. And again, the design is so you can flow that information each year. So it's getting better. There's still some physicians. I went to one the other day and they're like, all right, and they handed me a piece of paper. I'm like, what am I supposed to do with this? And they're like, well, just carry it in. And I'm like, oh my goodness, I work on these systems. So yes, we're working on it. It's part of the process. We have teams devoted to interoperability and releasing that information as easily as possible. Great question. So I want to talk about, I'll get into the cool stuff in a minute, but really how we've looked at it and kind of the pledges. So what we're doing, we built in a governance committee. So our goal, number one goal, is to increase the AI competency. Basically, does everybody understand AI? And not just, you all as patients, not just the clinicians, but our knowledge workers. And then how do we kind of triage and prioritize the project? So we built a governance process. And the governance is, a fancy way of saying we put a lot of people on a committee. So I get to run this committee. I think we have like 40 people. Every time we meet, more people like, can I be on the committee? Now, a great committee has probably 7 people. You get any more than that, it's just a lot of people sitting together. So we're trying, this is probably the most fun committee I've been on, where we're trying to look at it a little different. Not just to go through and bureaucratic red stamp all these different processes, but let's actually have a conversation. So we spend an hour every 2 weeks, and 30 minutes we do our business. Okay, what projects do we have to go through? Yay, nay, that kind of stuff, the budget, blah, blah, blah. But then the other 30 minutes we spend on, what do we think about this? Something we talked about a couple of weeks ago, I had an intern work on a mental health chatbot. Really cool, and I'll talk about the dangers in a little bit. But what if you can go to your therapist on a Thursday, and then what happens until you go 2 weeks later? While you're stuck at home, you start to get depressed, you're in a downward spiral of pity or whatever, and there's nobody to reach out to. You can't go to the therapist because insurance won't pay for it. There's not enough therapists in the United States, so you can't go to the therapist every day. So what if you had that stopgap in the middle? So I looked and we started to play with different mental health chatbots. The problem is they're super early in the development. There's some dangers associated with them. Some are great, but some are still a little bit rough. Need building in the garage kind of thing. And so talked about it. Is this something we should continue to look at? Is this something we should say, hey, this is too scary, let's walk away? Or is this something we should go head in and just start experiment? So those are fun conversations we're getting to have now as we sit with, I think there's probably 30 physicians on that committee, sitting wrestling, going, this is interesting, this is scary, this is dangerous, this is amazing, and wrestling through that. So the other thing, coming up with the compendium. Let's have a list of all the AI projects so we can clearly say, this is using machine learning, this is using algorithmic, this is using deep learning, et cetera, and classifying them. That way we know when something goes off the rails, where did it fall short? What is the part that broke in the system? Because you can imagine how big Lee is. So you got to know exactly where the thing broke, and we can't just shut the whole system down.
5 minutes, Joe.
Okay. Let me go really quick. I'm sorry. All right. So let me talk about some cool ones. So ambient notes. This is the most fun project I've ever had. It was amazing being able to save my daughter and not have to pay for a helicopter. But ambient notes. So we released this. We actually did a video that's on TikTok now. It's got about 20,000 views. We released it on Friday. And it's showing what ambient notes is. So really cool. Doctor walks in a room. We've got it with 100 docs now. By the end of the year, we'll have it in 1,000 docs' hands, providers, not just physicians. So you walk into the physician provider's office, and in the old days, they would turn their back to you, and they'd say, okay, tell me what's wrong. And the whole time they're sitting in the, you've been there, you've seen this. New system. Walk in the room, doc says, hey, I'm going to start recording the conversation. Puts his phone down, hits record. Now, there's an artificial intelligence tool running in the background. We get your consent, make sure you're appropriate, you're okay with it. To date, we've had one patient say no out of thousands. Said, I just don't want this. It was a whole custody issue. Anyway, fast forward. Listen to the whole conversation. You start talking about pickleball, about Costco, about how the price of a hot dog is still $1.50. It's amazing. Like, you start talking about everything. And you talk about your knee that's bothering you. And your heart pain, that, the LASIK isn't working, that kind of stuff. It strips all the unnecessary stuff. But did the knee pain result from your pickleball injury? Maybe, so it needs to include that in there. But it strips it all out. Within 90 seconds, the physician walks out of the office, and suddenly the entire record, pristine, is there in a nice little happy note. And it sends it to you in your language. So you speak German at a third grade reading level, we'll provide that to you in your custom language at your competency level. So it's not going to say all this crazy medical jargon that I frankly don't understand. It's going to send it to me in Spanish and say, you have a heart problem. That's where it's going. That's really cool. Like I get to work on this system. I get to design it, build it, and we're playing with it of how can we give it to more physicians. So again, our goal is by the end of the year, January, we'll have it in every single ambulatory provider. Next, we're working in the emergency room. Next, we're working on inpatient. Next, we're working on the nurses because they're burned out. Symptom checker, chatbot, ambient vitals. So I'm sitting at home and I don't want to have to go to the physician's office. So I've got a nice little patch now. So I'm not wearing it because I've been wearing them nonstop and it's driving me nuts. But I've got a patch that I can put on for 30 days, basically like an Apple Watch that keeps all these symptoms, but even more. It'll take my core temperature. It has a fall sensor. And so we're putting these on patients as they go on with heart failure, with COPD, all these issues. And then the AI is saying, okay, you need to focus on these 4 people because my resting heart rate is very different than somebody else's. So it needs to develop a baseline of what mine is. And then what we can do is we have a team of nurses, physicians, providers waiting in the wings saying, oh, I need to call John because something's not right. Call John. Hey, nope, I was out, I was picking up limbs from the hurricane. That's why my heart rate was so high the last, 2 hours. Okay, that makes sense. And we can, deprioritize me as opposed to, I don't know, I was just sitting here in my home. We need to get you in. So it's a preactive early warning system for us. Talked about the back office. That's not really exciting. Let me leave you with a lot of stuff. Some of the risks of AI. So, we're looking at all these, and again, we're working with FGCU. We're working with Aspen Institute. How do our staff, how do our knowledge workers, they're looking at AI of, am I going to lose my job? That's a big concern I hear very often. And so now we have to retrain those folks to say, you're not going to lose your job, you're just going to work at a higher competency level. I was able to take 180 employees through a project where they were just sitting watching a patient to make sure they don't fall out of bed. Not very exciting. We had a massive high turnover. We took them, put them on computers. Now they can watch actually 18 patients at a time, ran up about 12, and start to anticipate, be part of their care team. They'd never used computers before. They picked up the mouse and they were putting it on the screen. We taught them. So we retrained that workforce. We increased the job because they should be paid more appropriately. And now they're part of the care team. We're actually having a problem. A lot of them are leaving and going into nursing. And that's an amazing problem to have. So I'm going to go on my last one just because it's kind of cool or it's kind of scary. So social manipulation. I took a video. So this is our chief foundation officer, Chris Simino. He knows I made this video. So he called me up one night and he said, hey, John, I want you to talk to my team. I have about 100 people. I want you to talk about artificial intelligence and the dangers or something. I don't know what he was asking for. So I'm going to play his voice. And I'm going to step over here for a moment. So I'm going to play his voice just so you can hear it comfortably. Okay. So I'm going to play the video. So what I did was I took his voice and I basically cloned it. So I took a copy of it, digitized it. This was all free. And it was while I was in meetings. Don't tell my boss, but while I was in meetings for about 2 hours. I took his voice, cloned it, changed the words, wrote whatever I wanted, took a picture and a video of him I found online, on Vimeo, on YouTube, and on our leehealth.org website. Used a facial recognition tool to change the wording to basically deepfake him and produce a video. So let's see if I can put it in. Not gonna sound. Okay.
I did it.
That's right. So this video runs through, and it's actually what I said. So he said, John, hey, come speak to my team. What it actually produced was, hey, John, I want to introduce this amazing guy. He's going to come talk to our team. He's so handsome. He's elegant. And I'm actually going to pay for his kids to go to private college because I believe in him so much. I'm going to buy him a brand new car and, help me welcome him to the stage. So I played this. He lost it. His team was blown away. Now, this is scary. So I think of I told you I worked in banking for about 10 years, and I saw my next door neighbor give $150,000 away to a Nigerian prince because he won the lottery. Not really. He lost it. He was scammed. And I think of how poorly written those emails were. Fast forward, this scares me. When, your child calls you up, and deepfakes their voice, and not really your child, and says, hey, mom, starts to talk about something because they picked up on your social media feed that you were going on a cruise. Hey, mom, the cruise you're going to go on, why don't you send me your, power of attorney or something? So this is scary, and I'm not trying to alarm you as I leave the stage, but it's something you have to anticipate. We're trying to think of it, okay, it's scary, we have to be careful of it. How can we harness this? So as I'm sitting here, I came down here. How could I license my image? Movies are thinking about this. How can I license my image to allow me to speak and present here, but not actually be here? So that's where the future is going. That's why we're thinking. Again, these are amazing things. They're amazing opportunities and challenges. They're scary. But how do we can't just bury our head in the sand. We have to try to anticipate tomorrow's needs. Thank you.
Good. In the interest of time, what we'll do is, when we've heard all of the speakers, if you do have any questions, perhaps we could just take those at the end, just in the interest of time. But thanks very much indeed, John. I'm sorry that didn't work. It did work when I tried it at home, so they come in rather puzzled by that, so apologies. Anyway, I have a great pleasure in introducing Barbara Shearer, who... through thick and thin, managed to get here late last night at 12 o'clock, she said, and didn't go to bed until 1 o'clock this morning because, of course, our airport was closed down and Barbara was trying to get back down here. So it's very kind of her to have made such an effort to come here today. Barbara, in fact, is the president of a company called Neighbors Network of Lee County. It's a very, very interesting organization. And I'm going to let Barbara tell us all about it.
Well, I wouldn't miss this for anything because I love talking about this. So I was very happy when I was in the Newark airport. I didn't know if I was going to get home, and I thought, where am I going to stay? And then they took off. No turbulence. It was wonderful. This is the Neighbors Network of Lee County website. If you get a chance, please take a look at it. We have our newsletters on there. We have our events on there. Kim Daly created our website, and she's been wonderful and very responsive to everything that we need. So we spent a lot of time on this just to be sure that our front page would lead you to where you want to go. Our vision is to make the experience of aging something that is feasible choice in Lee County for neighbors helping neighbors and across generations. I'll tell you a lot more about that. I trimmed down my slides, but I want to say, our board is made up of Maricela Morado, Mary Poster, Bernice Kurtovich, Patty Duncan. Patty is here. Patty is the vice president. And And so and James Brooks, and we have a fabulous board. We talk to each other. We're definitely singing from the same choir book. So we are part of a national organization, and this is something that we don't have to belong to as a nonprofit, but it's our professional organization. There are villages across the United States. And so please, when you get a chance, go to the Village to Village Network website, and you'll see where all of the villages are in the U.S. You'll notice there are a lot on the West Coast in California. There are a lot on the East Coast, large cities. In Florida, very, very few. There's one in Tallahassee, Maitland, Wellington and West Palm Beach, and Tampa. There are villages that are being started now in East Orange and in St. Augustine. But it's amazing that Florida, with such a large population of people over 60, 65, have so few of these villages. We are all about thriving, and we say this a lot. When we started, we said, well, we want for people to age in a community, and we thought, no. I told people that, and they said, well, I'm aging already. They don't need to help me age in my own home. But it's all about thriving in our own homes. So together we are better. We have worked with partners from the beginning. We started in 2020 as a subcommittee of the Aging Coalition of Lee County, and we have built our relationships with all manner of organizations across Lee County, Area Agency on Aging for Southwest Florida, Dr. Piper Center. We've worked with Lee Health, many organizations across Lee County. That's our foundation right there, is that we are together and we're working on this together with our partners. Now, this has been the core of what a lot of villages are, and that is to provide these tasks, computer help, driving to appointments, friendly visits, help with simple chores, organizing activities, dinners out, reader, respite care, wellness calls. But this is a true business, and it can't be a very, lax way of looking at helping people. You need a volunteer corps. You need to be able to schedule them. You need to be able to vet your volunteers, train your volunteers, and have liability insurance. Though we are nonprofit, it is still a business. So it's really important for us to have many things in place before we can do one-on-one help in people's homes. Well, we know relationships are important. I think we all knew this before COVID, but now we really know it, and it's become part of the consciousness of funders and organizations across the U.S. that, loneliness, social isolation, those are health risks. And we know this. And back, when my mother was at home, she would say, I'm so lonely. And I think people, don't like to say that. They don't want people to think, this person's lonely. No, it's something more than that. It's being isolated. It's not having opportunities to make new friends and new relationships. This is our group. Just makes me happy to look at it, so I put it in there. The other thing is, with internet technology, a lot of people have tablets, but they don't know how to use them. And the Community Foundation awarded funds to the Area Agency on Aging for Southwest Florida, and they in turn were able to distribute them throughout their region. And they provided 15 to us. And we had classes. We located people who needed tablets. We were able to give them the tablets. We had 3 classes, one with the public library, one with the Area Agency on Aging, one with the Dr. Piper Center. We met 3 times. We provided the tablets. And that has kind of triggered some ideas about holding workshops purely on technology and also applying for grants for more tablets. Everything we're doing for the first time. So we are learning each and every time what we need to know for the next big event or the next stage of the development. So I want to ask you if you've ever taken Tai Chi. Do you like Tai Chi? What do you think, when you think of that? I have taken the class to teach Tai Chi through the Area Agency on Aging as a volunteer. And so I'm going to be starting that class in October. And it's fun. It's just it's fun. Will help with fall prevention, balance, confidence, and just being out to meet new people. So I'm going to be teaching that. I've been in the living room. I'm all over the place. My husband has lost total interest in this. But it's fun. So we have new programs. I want to say this. I took this other slide out. I thought I had too many slides, but we have done programs throughout the year. When we started, we did breath, body, mind, which is using the breath to manage anxiety and stress. And so our first instructor is a physician that I knew from my work at FSU. And he happened to be here too. A lot of coincidences on this journey. And so he started teaching this class at Unity of Fort Myers. They opened their doors to us, no fees for us to have programs there. And so that was our first program. Lee Health came to our aid, and we had workshops on dizziness, vertigo, balance, chronic disease. Sharon Krasinski and Natalie Grondin came. They were fabulous. So then we thought, well, maybe we should do some things on our own. So we are starting a new program called Strong People, Strong Bodies, Neighbors Network of Lee County, and RSVP. Now, the Dr. Piper Center holds the AmeriCorps contract, and we went to them with our idea, and they put us in their contract as a capacity building grant. And so we are starting this program. Strong People, Strong Bodies is based on research that, is very widely cited. And it's the idea is that if you lift weights, and we see some back there, I can't tell you how many weights I moved over the last month because we ordered a whole set of weights using the funds from the RSVP program. And so we're starting that in October. Now, that program is a national program, and we can get certification for that. And since we are one of the first in Florida, they are providing us with 15 free instructor courses. And at $500 each, that's significant for us. And we hope that as we start this program in Lee County, across Lee County, that we will be able to help other areas of Florida have this program. So those are the 2 new things. This is a series, Let Us Count the Ways, and we're starting that in October 17th. And the first one is on Medicare plans. Free lunch, and not just any old lunch. And so that is going to be at the Unitarian Universalist Congregation of Lee County. Again, a second congregation that just opened their doors to us completely, no strings attached. We do not have to pay for the space. This is the idea behind neighbors helping neighbors and creating community, the kind of community that maybe we all grew up with, and I certainly did. I'm growing up in a small town. So we're doing that on the 17th. We are doing one on fall prevention, one on other health choices, some on disaster preparedness and redefining aging. So this is something that we're very excited about. So if you can learn what you need before you need it, and if you have the connections with the agencies in the community before you need it, you are in fact empowered. And you know those questions, you don't want to ask them at the last minute when there isn't time to learn about a particular resource. And that's the point of this slide. So we want people to know and to be involved. This is all about community. What we did first in 2020, starting in 2020, is we created this network. We got to know the people in the community. You know, when you go to the professional meetings with all of the people and organizations in Lee County who have a passion for helping older adults, then you're colleagues, and you get to know them, and they trust you, and that they know if you say you're going to do something that you are. And that is how we've established these relationships with the Area Agency on Aging for Southwest Florida and Dr. Piper Center and other organizations. Then we did the programs for health, wellness, and social engagement. That's how we're getting volunteers. They meet us. You know, I'm not likely to go to a website and just read something and be a volunteer. And as someone who's looking for volunteers, I don't know you when you volunteer for something. But when you come to our meetings and we talk, you might come up to me later and say, I want to teach Tai Chi. I want to take the class to learn how to do breath, body, mind. And that is how we're meeting people, face to face. We need to raise funds. From the beginning, my idea was, okay, I'll volunteer. No fees, I'll volunteer. I like that. I like that we thought that and believed that at the beginning, and we still do. But we do have to raise funds. We can't just, we must raise funds. Every time we recruit and train a volunteer, it's $50. And a lot of the villages, it's a 1-to-1 ratio from the beginning to have one volunteer to one person that you're helping. But at the same time, it's very clear to us that you're both a volunteer, you're a helper and a helpee, and those are interchangeable across time. You might not be able to drive to your doctor's office, but you can help with technology. So even though a lot of the models are based on people getting help from other people, we are all in this together, and that's why we're not charging anything. We're starting with the 6 Mile Cypress area. That's where Patty and I both live, and the churches who are helping us, that's where they're located. And then we're going to create a hub so that we'll start villages across all of Lee County. It's a big vision, but we're going there. I mean, I've never had one doubt in my mind since we started working on this. Everyone has a mother. Everyone has a child. Or some people have children. I have nieces and nephews. But everyone has a mother, a grandmother, and they all, talk with me. The minute I talk about this, they immediately raise the issue of a parent that moved to Fort Myers, and they moved next to be near them. Then the parent moved back north, and then the parent found that they didn't have, anything to do. It's just, you have these ideas that if you move to where your children are, they're going to drop everything and spend all their time with you. But really, your friends are somewhere else. So that's one important part of this. And then, of course, we are still a jazz band. We really have a passion for this, and we've learned about this, and we're learning along the way. But we're still, planning as we go along. What do we need? How are we going to get there? So thank you. I timed this with my sister. And she said it was okay.
You did great. Barbara, thank you, and I certainly wish the organization all the best. I think many of the things that you mentioned are important to us too. I know that we feel that loneliness is a very key issue. In fact, you will find an article on our website relating to this because it's so important. And of course, some of you may remember Jody Walburn from Blue Zone spoke to us not very long back about all of the reasons why people live longer. And one of the key reasons behind that, of course, is having a family, having neighbors, having friends around as one ages, which actually has an extremely important and very profound effect on one's lifestyle and a means to age perhaps even longer than one might otherwise. So all of those things are extremely important. I would like to now introduce Mary Schoeffel, who's the Executive Director of the Parkinson's Association of Southwest Florida. Unfortunately, Kay Jasso, who is the CEO Director of the MS Center, was unable to make it today. She was flooded out and was unable to leave her area, so we apologize that Kay can't be with us, but I did wish her well and hope maybe that we will get her back on another occasion. But now over to Mary, and we'd like to hear a little bit about what you're doing for the local community in this regard.
Thank you very much for the invitation. We are very happy to be here today. And of course, your neighbor, Sally Watts, is with us. She's one of our new employees, and we are so excited to have her on the team. I overbooked myself, so I have to be somewhere at 11:30. So I'm going to start at the back first, which is to say that Sally is here to answer any questions afterwards about specific issues related to our programming or questions about our programming. And she's got 2 handouts that you can pick up as well as some other things. We serve Collier and Lee counties. That's it. We are a standalone organization, and we are here for those with Parkinson's, their families, because together, that's how you survive this disease. It's exactly what Barbara said. It takes a community to support seniors. It takes a community to support someone with a degenerative disease. So I'm going to sound like Debbie Downer for just a minute here, but I do have some good news, and I am not talking to my slides. So you can go back and watch these slides on YouTube. How about that? So what is Parkinson's disease? Yeah, right. Fine, dandy. It's been around for a while. This is hard to read, but I want to leave this up. This is so important because, sorry, I'm walking. Pointer. I don't have to walk. There we go.
Yeah.
The hardest part about Parkinson's disease is it takes forever to diagnose. Look at that. All of that's happening 10 years, really and truly, before you actually get to the diagnosis. You might have heard that Brett Favre, the football player, let slip in a congressional hearing that he has Parkinson's disease. So a doctor at UF, who's the head of the Fixel Center, which deals with neurology and Parkinson's disease in particular, has written a book. But he was quoted in that article, and this is the first time I have seen this in layman's language, not in a journal sort of thing, and it makes so much sense, so I'd like to read it to you. The first signs that a patient may have Parkinson's can be quite varied. You'll see 10 on that piece of paper. Loss of smell. This was a good one during COVID because people thought and learned that loss of smell could actually have an impact on your brain and other things. Loss of smell. Constipation, the acting out of vivid dreams, anxiety, and depression can all manifest before the signature symptoms. So what did I just say? We have all of this here with depression and problems sleeping. All those initials in there have a lot to do with sleeping. All of that is happening before, and not everybody has the classic symptom. So the classic symptom being the resting tremor or stiffness. We've learned, Dr. Oken said, there could be clues that appear first. And because of the huge range of potential symptoms and the slow progression of the disease, Dr. Oken says that this is one of the most complex diseases in America, in the world, in medicine. Bottom line, Again, sounding like Debbie Dowd. It's degenerative. There is no cure. We are working that direction. We're getting better. There is no definitive diagnosis. A drug that's been around for 50 years, if you have a tremor and you take it and your tremor diminishes, well, that's a pretty good clue that you have Parkinson's disease. But again, not everybody has tremors, and it takes 7 to 10 years sometimes for the tremor to develop. So where I'm going with all of this is there are 3 things, in short: mood, movement, and muscle. The depression that comes along with the changes in your body's ability to do what you're used to doing. Parkinson's can last for 20, 25 years. Parkinson's is not going to kill you. We are here to help you live well with Parkinson's because there is research, there is proof that what we make sure is available to you can help you live well with Parkinson's. So let's just slide through here. Bottom line is we're here to help you live well with Parkinson's. And our whole point is to enrich the quality of life and empower you as you go through this. The key thing to remember, though, is your neurologist. I mean, we've already heard there are not that many neurologists around, and they're treating all kinds of diseases and accidents that happen. You're in a car accident, you bang your head, your daughter, thank heavens she's well. There are not that many of them around, but it is not just your neurologist that gets you through this. It's your therapist, it's your primary care provider. They all need to be talking and on top of your meds and your progress, and they need to be aware of what's changing. But we strive for excellence every day, and that means we work diligently to make sure you're doing well. This is what makes a difference. Everybody knows you need to exercise 150 minutes a week. Okay, it is so important for people with Parkinson's to make sure that they are moving. Not getting too technical, but there's a thing called a blood-brain barrier. And lots of things can't get past that, including a lot of drugs. The drugs that are available are replacing, there's a bank in your brain of dopamine. It's a finite amount. And as that diminishes, your symptoms for Parkinson's increase. So while carbidopa, levodopa can mimic that, you can't replace that bank. It's not like you can have a transfusion and it all goes in there and you just start over from scratch. It doesn't quite work that way. But you have to move to get it circulating in your system so that the delivery works, because the drug takes forever to disintegrate, digest, however you want to put it, and it takes its greatest effect once it gets into your lower intestine. So you take your drug and it's going to be 30 to 40 minutes before you are on it again. This is not quick relief. So first and foremost, we have in-person and Zoom programs. We have learned from our members that given seasonal traffic, they would prefer to do things by Zoom because then they can do more during the day than they could if they're driving from point A to point B and stuck in traffic. So, movement, 15 times a week. And Tai Chi is one of the things we make sure we have. That's every Monday with Karen. People love it. Support, we've talked about, Barbara talked about, and I talked about mood. Depression is definitely something that comes along with this particular disease for a number of reasons, and we make sure we have support groups. We have a support group for women with PD, men with PD. By the way, men are 1.5 times more likely to have PD than women. We have it for couples. We have it for the female care partners. We have it for the male care partners. And we have several general support groups. We make sure that everybody has an opportunity. And a lot of those groups meet weekly because regular community of other people with similar issues is a helpmate. We also have speech that gets into when the muscles start to fail in a number of different ways. And then we have educational opportunities, PD talks in person and via Zoom as well. I mentioned members. We are a member-based organization. This is a calendar if you want to take a quick look at how everything flows. Membership is free. You just have to go visit Barbara, learn how to use your tablet, go to our website, and in that lower corner there, after about the count of
Look,
Did I turn it off?
I think so. It's out and figures just I think they have.
Thank you. I hit two buttons at once.
Nope.
Give it about a count of 10 and that little blue button pops up. And once you fill out that, Sally will send you an email and give you a call and welcome you to our association and learn a little bit more about you, what you like to do, and see what we can make sure, how we can fit everything together. But the bottom line is you have an opportunity for social engagement. You have an opportunity for everything that research has shown. Again, back to the education, back to the exercise or movement. We have everything from seated yoga to a standing 45-minute exercise program at a local fitness studio that meets 3 times a week. And during season, it meets 6 times a week. So there are lots of people who come down and want to keep moving. And, if you happen to be a snowbird and you're up north for the summer, you can continue via Zoom, or we have recordings also in our members-only section of a lot of the exercise programs so that you can continue doing that. But the bottom line is we hear stories, not quite daily, but every week. I've been using my walker for I don't know how long. I started to do the seated yoga and I felt better. And so now I use my cane walking around the house instead of my walker. Mm-hmm. We hear stories about people who used to use a cane to get in and out of the house and into the car. And they feel better. And depending on where they're going and how far they have to walk, they'll carry the cane. They don't use it. It makes a difference for all of us. It increases people's confidence in themselves and their abilities to continue to contribute to society, to be a part of a healthy lifestyle. One of the stories that I always remember is a member had been refusing to join anything. He said, yeah, he told his wife, people keep going. Well, he called her one day and said, the pharmacy keeps hanging up on us. There's something wrong with our phone. I'm calling to renew my prescription. So she gets home, she uses the phone, and she renews the prescription. And she said, well, you keep saying what? Or I keep saying what to you, and I keep asking you, what did you say? I'm sorry I didn't hear you. How about you go to that speech class for a little bit? So he went to the speech class. Went about 6 times. She said, have you noticed I'm no longer saying what? Yes. Well, yeah. She said, I think that speech class is making a difference. So he kept going. So he ended up reordering his next round of prescriptions. He succeeded in getting through, and the pharmacist could hear him on the other end of the phone. But the bottom line with the speech is, don't you want to tell your children how much you love them? Or if you have a grandchild in the house, how about telling them how much you love them? If they can't hear you, if you can't communicate your needs, that begins that spiral again. I am no longer in charge. I no longer have independence. And that's one of the reasons we keep all of these programs going, is because we want to make sure that you feel comfortable in your condition, in your own home, in your life, so that you can live well with Parkinson's. There's a flip through here. Again, Sally has some flyers in the back about what we raise here stays here. And everything, again, all of our programs are free. Community, grants, our events help keep us with the status quo and the level of programming that we have. And then these are some resources. So again, this will be on the YouTube link so that you can go back and look at those resources. A lot of these are national organizations, so we are eternally grateful for the research that they do. And we are almost to the point where there will be a definitive diagnosis. We're getting there so much faster. Michael J. Fox's work with gene studies is making a huge difference. But there are just so many different things we still have to learn about this disease. And while they're doing all of that work, we are here to make sure that you, your loved ones touched by Parkinson's disease, live well. So thank you.
Thank you. Thank you all. The speech is really great, and I hope you all enjoy them. As I said, I'm going to just mention a few things about Engage Estero, some of the things it's doing. I will clearly make it quick. On November 12th, we're going to have a public forum at FGCU and it's going to be basically on climate change, the kinds of issues that people are going to have to deal with. We see it happening all along right now, hurricanes, and a variety of other things, but we've got some really top-notch people that are going to be there. If you get our emails, from Engage Estero, you'll get plenty of information how you can sign up, etc. It's going to be first one comes first served, and we think it's going to go fill in very quickly. On the 27th of February, we're going to have our second Don Estero Person of the Year award, and this one's going to have two people that are going to get it, so it's going to be persons. And Joe Pavich and Joni Pavich, some of you may know Joe and Joni, very active in the community, and we're going to have it at the Vines. Last time we had it at Grandeza. We're into fundraising right now. One of the speakers mentioned earlier that you have to do some fundraising. You don't stay alive without it. We are a not-for-profit 501c3 organization, and we had a 4-phase approach to this. We've gone through the first 3 phases, and now we're going to be getting out and talking to more people, and we think we can reach a goal that's fairly realistic. I encourage you to go on to our website. You'll find a number of articles in there. Allan mentioned 1 or 2 of them. Several recent ones were done by Mark Levinsky. He's there now. He does a lot of work on the kinds of activity that's taking place on Corkscrew Road and all that road things that are going down there. Terry Flanagan has been working and giving us some information on the importance of workforce housing, getting people that serve us and do it in a variety of different ways, police, firemen, nurses, etc. People in the restaurants, they have no place to live in Estero. Can't afford to do it. So we need to do something about it. It's not only an Estero issue, it's a national issue. But we're going to be trying our best to try to encourage people that can do something to make it happen. We're also very much interested in the environment, as I mentioned about the climate change, but we're also trying to get the village to appoint somebody that would be an environmental resource manager, somebody that could advise the council on the kinds of issues they should be thinking about, keep them out of trouble, etc., by doing the right thing. We think that would be very important for us. Secondly, it opens the door for people who are really into the world of the environment, whether it's water quality or lowering carbon footprint or whatever, to have access directly into the village so their voice can be heard and things can change. Engage Estero has been around for 25 years. We used to be called the ECCL, and we're going to have a 25-year anniversary sort of planning. There'll be a variety of things we'll be doing just to celebrate the kinds of people that made ECCL Engage Estero what it is and actually created the village of Estero. So that kind of information, I think, is going to be interesting, and I hope you'll enjoy it when it comes around. And I did mention the Person of the Year. There are a variety of other things that are taking place, and because of the time, and I'm watching the time from the back of my head, I'm respecting your time. We won't go into it, but I encourage you to visit esterotoday.com. It's easy to do, or just punch into Google Engage Estero, you'll get right to our website. And take a look at what we're doing. Our whole purpose is to inform people about things that are going on in the area, things of significance, to have these kinds of programs that we had today, to engage people, get them involved in what's going on in the community, and make an impact. That's basically what we're about. So thanks again for coming. We appreciate it. We were surprised we get as many as we got because of the weather, but it's been good. Thanks again. We appreciate it. Have a great day.